Jack Smith is a 55-year-old male with morbid obesity, diabetes type 2, and chronic hypertension. He is medically retired and lives with his spouse in a single-level home. He was previously independent with no pain or limitations and ADLs. He was referred to home health OT. He was admitted with heart palpitations to the emergency department via 911. Mr. Smith spent 5 days in the ICU for an infection of his diabetic foot ulceration. He was then sent to the PCU for observation and therapy orders. OT evaluation identified Mr. Smith as having difficulty managing with dressing, bathing, functional transfers, and functional mobility secondary to his debilitated state. Mr. Smith was discharged to home health OT with support of his spouse. Mr. Smith is taking the displayed medications for diabetes and blood pressure management. Precautions include standard precautions for infection control, hypoglycemia, hypertension, skin integrity, loss of protective sensation, and risk for falls.
Hello, Mr. Smith.
Hello.
How are you feeling today?
How I look. That's how I'm feeling.
You're looking great. Hey,
Thank you so much for
Smith.
coming.
Hi, my name's Kelly. I'm an occupational therapist. I know that you had just spent some time in the hospital, and I'm sure you're happy to be back home.
Yeah, finally.
Yeah. So you had a non-healing diabetic ulcer on
That's
your...
right. They gave me this big bandage, and I gotta take care of it.
We
now.
really don't know what to do with it.
Yeah. Okay. I see that you got septic from that.
I was really sick.
Yeah. Okay. Well, now that we're home, I'm here to evaluate to see how well you're able to take care of yourself and function. So I know that you're going to be assisting with his
Yes, anything you need, I'm willing to do.
Okay, great. So first, we're just going to get started with taking some vitals and see how you're standing there.
Sure.
Sound good?
Yep.
Okay, Mr. Smith, so I'm going to take your blood pressure and then I'm going to put this on your finger so we can measure your pulse and your oxygen levels. Does that
All
sound
right.
good?
I'll warn you though, my blood pressure's always been high.
Has it been? Okay. Well, we'll see how it is today. See your arm. Here we go. Okay, now we're going to test your range of motion to see how much flexibility you have in your
All right,
joints.
good.
Does that sound good? Are
That's
you
fine.
experiencing any pain in your joints right now?
No pain. No, not typically, no.
Not typically? Okay. So just follow along with I do, and we'll, if any of these motions cause you pain, let me know and we'll stop.
Okay.
Okay? Shrug your shoulders. Okay, bring your hands up over your head. All right. Bring the back down behind your back. Okay, now back to your side. Out sideways, up above your head. Is that a little hard for you to?
Yeah, a little bit. That's
Okay.
all right.
Can you bend your hands back behind your head? Okay. Bring them back out. Down behind your back as if you're tucking in your shirt.
I haven't been able to do that.
Oh, is that hard too?
I got some fluff.
Okay. Sorry. Okay, so now bring them out in front of you. Touch your shoulders. Okay. Palms down, palms up, pinkies in, thumbs out. Can you bend your wrists? Okay, unbend them. All right, make a fist. Okay, Mr. Smith, now that we've seen how much range of motion you have in your joints, we're going to test the strength of your muscles in your arms and legs. Does that sound good?
That sounds fine to me.
Okay, can you go through this motion for me?
Yep, I got it.
Okay, does that cause you any pain?
No pain.
Okay. So now on the count of 3, press up against my hand as strong,
Okay.
as strong as you can, okay?
Alrighty.
1, 2, 3. All right, you can relax. Okay, now we're going to do some sensation testing. First, we're going to do touch awareness. So I'm going to use this cotton ball and touch different areas on your body, both right and left arms and legs. Okay, so when I touch you with the cotton ball, I want you to just say yes if you feel it, okay? So close your eyes and turn to the side.
Yes.
Yes, okay. You can flip your hand over.
Yes.
Yes.
I think. Yes.
More?
Yes.
Okay. Okay, so next we're going to test your grip strength and your pinch strength. Now we're going to test your grip strength. So squeeze, 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 squeeze. Great.
Now we're going to test the strength of your pinch.
Okay, the next thing we're going to test is diagnosis. And so I'm going to place some items into your hands. I'm going to start with the left and then the right. And you're just going to tell me if you can tell what the item is. You're going to
Okay.
feel it out and tell me what you think it is, okay?
Sounds easy enough.
Yeah, so just close your eyes and hold out your left hand. Okay, go ahead, feel it and tell me what you think that is.
It's flat. I think
Yes.
it's flat. I don't. really tell.
Can't really tell? Okay, here, you can give it back. We're gonna try one more. Stick out your hand again. Okay.
Feels like some sort of shape.
Yes, that's true. Can you tell what shape?
Is this I think this is a dice.
Yes, it is a dice. Great. Okay, Mr. Smith, so now we're going to do some balance tests. So
All right.
I'm going to have to put this gait belt on you. It goes around your waist, so you'll be looking extra fashionable today.
Okay.
There we go. Perfect.
All right, suck it in.
Yes. Don't worry, it'll fit you. Okay, is that too tight? How does that feel?
I'm still breathing.
You still breathing? Good. Don't want that to stop. Okay. Now, what I want you to do is you're gonna push off the couch, and I'm gonna give you some assistance here to stand, okay? On the count of 3. 1, 2, 3. Okay, Mr. Smith. First, I want you to start out by putting your feet together like this. There we go. Now we're just gonna stand. How do you feel?
I feel fine.
Fine. Okay. Now, can you close your eyes for me?
Oh, I don't know about that. I'll try.
Okay, we're gonna sit. Here we go. You feel the chair, reach back. There we go. We're gonna test your endurance. Are you up for that?
Oh yeah, why not?
Okay, so this test is called the 5 times sit to stand. So what I want you to do is first get seated up in your chair upright. All right, now cross your arms over your chest, and now what you're gonna do, without pushing off, you're gonna stand up from the chair 5 times.
That's gonna be tough. But
Tough?
now that I'm not on that couch, I think I'll be able to get up a little bit more easily.
Okay. Well, I'll be here if you need any assistance, and if you feel safe or unsafe at any time, just sit back down, okay?
Got it.
So as quick as you can, as steadily as you can, 5 times up and back down, okay?
Okay.
So I'm gonna time you. 1, 2, 3. Very good. 2 more. Just 1 more. Okay. You did great.
Based on the results from the Home Health Occupational Therapy Profile, currently the client is seeking services to improve self-care management and functional mobility, including transfers and ambulation. He stated priorities are to increase his ability to perform and tolerate his daily activities, decrease the care burden imposed on his spouse, improve fall self-efficacy, and to properly care for his foot so that it may heal. Results of the Home Health Occupational Therapy evaluation were: vitals were consistent with the patient's norms, range of motion of upper extremities was within functional limits, manual muscle testing showed a 3+ out of 5 for shoulder motions, a 4- out of 5 for elbow motions, a 3+ out of 5 for forearm motions, and a 3+ out of 5 for wrist motions. Functional strength screening of lower extremities revealed strength deficits. Grip and pinch strength were below normal values. Sensory testing revealed diminished light touch and impaired sterognosis of the upper extremities and diminished light touch and impaired proprioception of the lower extremities. The Romberg test revealed problems with proprioception. The 5 times sit to stand showed increased disability and morbidity. The CATS Index of Independence and ADLs, the client scored a 2 on, indicating severe functional impairment. Revealed was the client's need for assistance with getting in and out of the tub, bathing more than one part of his body, collecting clothes from the closet, completing parts of his lower body dressing, managing clothing fasteners, and getting in and out of bed.
It's a pleasure. My name is Sally. I'm going to be your occupational therapist.
Nice to meet you. Oh, this is Murphy.
Hi, Murphy.
He's always with us.
I have a pup too, part of the family, right?
That's right.
Wonderful. So I'm here to discuss the treatment based on Kelly's evaluation. So there's a couple of things we're going to focus for today. First, we're going to focus on safety and transfer. So that means we want to make sure that you can safely get in and out of the bathtub as well as in and out of bed. We're also gonna focus on your skincare and inspections for your diabetic wounds. Also, trying to make sure that we keep that wound dry during showers. And lastly, we're gonna do review of energy management. Does that sound good?
I think it sounds great.
All right, do you have any questions for me?
I don't have any questions.
I don't think so. I think we're ready to get started.
All right, let's start the treatment. So we're going to be discussing transfers, and I first want to talk about energy conservation techniques that you can use to make sure that you're going to be as efficient as possible. So number one, you want to make sure that you have everything as close to you as possible. So you just want to set up your environment, make sure your towel and you have your clothes nearby. Now, I know you've been having difficulties getting in, so I'm going to show you technique that you can use to get in. And I want to stress the shower share as well, just to make sure you're also conserving your energy while you shower.
All right, yeah,
All right.
so I can't step into that tub at all.
Yes, so we're going to do so as you come into the bathroom. You're going to slowly come over here. We're going to do a small turn with the walker. Slowly. And then I want to make sure your feet touch all the way back on the tub. Bring your walker all the way back as possible. You're going to reach with your left hand back. Make sure you have support on the chair and slowly come down. All right, once you're here, you can scoop back. And here, once you have support, one leg at a time.
Okay.
All right. And when you're here, another thing we want to touch about now is some inspections that you want to do. And you also have to manage your wound care because you cannot get it wet. As your nurse has instructed, you cannot get your toe wet because of the open wound, so it is crucial for you to make sure that we're gonna bag this. So part of your shower prep is making sure you know how to put on this bag
Okay.
and tape it to avoid getting wet, in addition to not spraying that area.
Okay.
Right? So what I want you to show me, we're gonna slowly, as safe as possible, we're gonna try putting it, I want you to try doing it by yourself first.
Just like that?
Yep.
All right.
And now what we're gonna do is we're just gonna close the back here. All right. And we're gonna tape it, all right, and then can you reach the shower? Great. All right. Mr. Smith, now you're gonna demonstrate getting out of the shower as instructed.
Okay, I start with lifting my legs out, right?
And you're focused.
And as you said, I scoop forward in my seat. And I don't want to pull from my walker, right?
No.
Okay, I gotta push from here. I think I might need a little help to get up though.
Okay, I'll just stand right by.
All right. 2 and
3. Good. Look at that. Did it all by yourself. Mr. Smith, this is going to be a preventive measure because of your peripheral neuropathy. You have limited sensation on your foot. This is why this wound happened in the first place. So what we're going to be doing is every time you're going to be getting dressed as part of your routine, you're going to do some self-inspection with this long-handled mirror. I'm going to leave it here. So what I want you to do is you're going to put one foot out at a time, toes up, and you're going to make sure that you can see every part of your foot, and then you're going to come to your heel and heel up. Right, and then you're gonna do it on the opposite side. Right, so I'm gonna have you demonstrate for me. Do you have any questions?
Do you have any questions?
Not so far.
All right.
All right, Mr. Smith, demonstrate, please.
So just like this. I'm just looking at all the parts of my foot. And my heel. Oh yeah, there it is. All right, I think I got it.
Mr. Smith, you did great on your session today. I'm really proud of all the work you did. I want to discuss what we're going to be starting to do in our next session. We're going to go over some energy conservation techniques as well as some exercises to strengthen your grip on your hands.
Okay.
All right, so if you look at here, we're just going to talk about pacing, simplifying tasks, avoiding fatigues, and avoiding any unnecessary motion. So we'll go through each of these next time, and as well as doing the exercise and creating a home exercise program for you.
Perfect, sounds great.